has a new clientele, men in search of that perfect appearance. What are they looking for? Find out tonight.
Tonight, a look at the 90s man who isn't ashamed or afraid to go under the knife. WGN's Eddie Aruza is here with tonight's cover story. Eddie.
Allison and Steve, for decades, it's been mainly women who've headed to plastic surgeons for facelifts, nose jobs, even sometimes a complete reshaping of their bodies, not only to look fitter and younger, but also in a belief that looking better might help in a competitive job market. Well, now cosmetic surgeons across the country are reporting an increase in male patients who say they need to make a change in order to become a better man. But it's no secret why more men than ever are going under the plastic surgeon's knife.
Started with this one before yet or no?
Chris Lenz is one of those men. The 32-year-old health club worker is surrounded daily by people trying to change themselves the natural way. What Chris wants to change can't be accomplished on fitness equipment. You may not see what he finds flawed, but Chris insists his nose needs perfecting.
I'm the only one I have to answer to for this. You know, I'm doing it for a number of reasons. One of them, obviously, is for the workplace, absolutely.
After considering it for 2 years, Chris has decided to go through with it. His plastic surgeon explains what will be done.
Ideally, what we'd like to see is a nice straight line here with a little bit of definition of the tip.
According to the American Society of Plastic and Reconstructive Surgeons, women still lead men in elective cosmetic surgery. But since 1992, the number of men having plastic surgery has shot up 33%. 1 out of every 4 rhinoplasties or nose jobs is now being performed on men. 1/4 of all chin implants are going to men, and nearly half of all ear surgeries are on men. Plus, one of the most requested procedures among men is lifting sagging and tired-looking eyelids. Some of the procedures are corrective, and some are out of sheer vanity. But increasingly, cosmetic surgeons are being visited by men like Chris Lenz, who say they need to look a little more perfect and more vibrant in order to succeed in business.
Men, particularly in public-oriented fields, believe that they can't look old, they can't look tired, and they can't look angry. And all of those things can be conveyed by the expression both around your eyes and in your face.
The procedure most requested by men, however, is liposuction. Tummy tucks are still the domain of women, but 41-year-old Wilfred Lahara, who lost a great deal of weight by dieting, wants a tummy tuck to get rid of excess skin around his midsection. Lahara, who works for the CTA, says he wants to go through with it for health reasons as well as for the workplace.
People are very direct, and if they see you that you have a belly or something, they'll tell you they're not tactful at all.
The more I'm here and the more I see other people improve, the harder look I take at me, and the more it gets reinforced to do something like this.
And Chris Lenz did indeed make the change. Tomorrow night, in the second part of A Better Man, we'll show you Chris in the OR as well as on the day he first viewed his new look. We'll also bring you the perspective of employment experts on whether plastic surgery can make any difference in the job marketplace. Stephen Ellison.
Okay, we might ask you how much some of these cost tomorrow, too, okay?
We'll talk about that, too.
Right,
thanks, Eddie.
He has a new clientele, men in search of that perfect appearance. What are they looking for? Find out tonight on WGN News at 9.
WGN's Eddie Aruza joins us now with more. Eddie.
Allison and Steve, as we reported last night in the first part of our series, the number of men going to plastic surgeons is higher now than it's ever been. And increasingly, those men are telling doctors that they feel the need to look younger and better for a competitive job market. We accompanied one such man as he underwent surgery and also talked to employment experts on whether cosmetic surgery can produce a better man. The procedure that plastic surgeon Rodger Pielet will perform today is routine and simple. His 32-year-old patient, Chris Lenz, is having rhinoplasty, commonly known as a nose job. Lenz may not look like someone who needs his nose fixed, but he says his job at a health club has convinced him to do it.
You know, being in an environment where you see people getting healthy, they're getting better, they want to look better and everything else, you know, it makes me want to look better.
Like most plastic surgeons, Dr. Pielet can't assure any of his patients that surgery will make a difference.
Although we never want to make a guarantee that it would make them more competitive, I think it does help. And I've seen that numerous times. People come back to me and say they feel better about themselves, they have more confidence, more self-esteem.
Women still lead the way, but since 1992, the number of men having plastic surgery has shot up 33%. And cosmetic surgeons report the principal reason for it increasingly has to do with looking better and younger for a marketplace that seems to favor fitness and youth. Fred Lahara would like to improve his image with a tummy tuck. The 41-year-old recently lost over 40 pounds and was left with excess skin around his stomach. Lahara works for the CTA and says he needs to look more fit in order to exude confidence and garner respect. It all comes with a price.
We went to the figures to round it up. It costs around $10,000.
Are you prepared to pay that?
I'm prepared to pay that. If it's going to make me very happy, of course.
I think the right reasons are wanting to enhance one's own appearance, not focusing on the fact that it may help them in the job market, it may help them in the social setting.
Famous industries. Oh, there we go.
But can plastic surgery really help a man compete in the marketplace? Grace Marie Soper and Karen Shore are professional recruiters, better known as headhunters. They admit looking good can play a part in the business world.
All right, if I'm interviewing for a CEO position and a person comes in and he has had this done and he still has all the qualifications, that man is going to be the successful one.
But the bottom line, they insist, remains qualifications, ambition, and assertiveness.
You can't make somebody a competent vice president by changing their look on their face. You just can't do it. They either have it or they don't.
However, for some men, having it means feeling better, younger, and more fit. Just days after his surgery, Chris Lenz had his splint removed and got to see the new him.
So what do you think?
I like it.
Now, whether you're a man or a woman, if you've been considering any kind of plastic surgery, the American Society of Plastic and Reconstructive Surgeons has a couple of ways of contacting them for information on procedures and where to find board-certified surgeons. You can call the Plastic Surgery Information Service toll-free at 1-800-635-0635 or visit their website at www.plasticsurgery.org.
So we heard, what, about $10,000 for that tummy tuck? Is that about the going rate for these procedures?
Well, a nose job such as the one that Chris had is running around $3,000 these days, and you heard Wilfred say that his tummy tuck will cost about $10,000. Most procedures run somewhere in that range, but they're rarely covered by insurance. What the experts warn is not to choose a surgeon just based on cost, but rather make sure he or she is board certified, and even to ask to talk to former patients.
Okay.